We need the physical space. We need the appropriate level of supplies, PPEs, ventilators. But the most important, precious resource is people. And we had a call to people all across the state of California, people whose license had expired, people that are retirees, people that are in the profession but haven't finished their licensing requirements, be it nursing schools or medical schools. Remarkably, over 25,000 people already have filled out applications on our healthcorps.ca.gov website. Over 25 licensed Californians, phlebotomists, radiologists, EMTs, doctors, nurses. A remarkable, remarkable spirit and a remarkable number of individuals that stepped up and are willing to step in to meet COVID-19 head-on. So I want to just begin my comments by thanking all 25,000, and those of you that are out there that have the kind of expertise, that may have retired recently or are looking to get their license renewed, please check out the healthcorps.ca.gov website and contribute your time in a compensated manner to meet this moment. We're also getting a lot of questions at this moment about masks, not just N95 masks, not just surgical masks, not just masks for our frontline employees, particularly our healthcare professionals, but people that are in the grocery stores wondering if they should have a mask, people walking the streets, walking their dog, going to do essential business in the state of California, whether it's appropriate for them, whether it's advisable for them to have face coverings. We've been processing this over the course of the last number of days. There's a number of viral videos that are filling up my inbox. I imagine many of you watching as well, Czechoslovakia and other parts of the globe that have moved aggressively to advance protocols on face masks or other kinds of face shields and the like. We have a team that is considering guidance in this space to make recommendations whether or not we think this is appropriate. But let me caution on this topic a number of things. We are in real need of traditionally, surgical masks and these N95 masks. We are out there sourcing them from all around the globe. We have distributed some 32.4 million N95 masks to date, 32.4 million N95 masks, but we have ordered over 100 million of these masks. We need 100+ million N95 masks just to meet the needs within our healthcare delivery system. The concern we have when we talk about face coverings in masks is people run to get the N95s or they run to get the surgical masks, of which we are procuring tens of millions of surgical masks at the same time. And so we want to be cautious in this space. We want to be guided by science, and I'll just say this respectfully, science is a bit incomplete in this space. A lot of people are promoting face coverings and masks. Others caution that it is not a substitute for physical distancing, which it is not, and that it could create a sense that it is and may reduce the protocols that have worked so effectively so far here in the state of California. But know that we are looking to put out guidance on this. We'll put out our recommendations in short order as it relates to face coverings, and those recommendations will include the principal obligation we all have to continue our physical distancing, our social distancing, to wash our hands, and if we are putting face coverings on, we'll lay out guidelines in specific terms of what that means and what it doesn't mean. The last thing we want are people putting on coverings and moving them in their hands, not washing their hands, and potentially creating additional issues, people getting the wrong kind of impression that somehow now they're absolutely immune from contracting the virus and the like. But I know that this is becoming a major issue all across the United States. CDC has implied they'll be putting out some guidelines. I know the President himself and others have made reference to the same. We get this question all the time. When you go to a grocery store, people are trying to practice appropriate physical distancing. You feel like you're not necessarily capable of doing that in a short queue. The appropriateness of having these masks or a version of face covering. We recognize that anxiety, and we want to meet that in terms of recommending specific strategies. And so expect in the next 24 or so hours that the state of California will put out more prescriptive guidelines in that space. We also are very proud here in California. We had incredible leadership that is demonstrable in the state by Cesar Chavez. That leadership was recognized formally as this day is every year, Cesar Chavez Day. In the spirit of contribution, the spirit of service, in the spirit of meeting this moment, we are also announcing an effort to do more and do better to protect our seniors in the state of California. We have 5.3 million Californians that are 65 years and older. And we've been doing some remarkable things at the local level to check in on our seniors, wellness checks to make sure they're getting their medications, making sure they're getting their prescriptions. But we need to step things up significantly. And that's what we are announcing here today, a statewide initiative, working with our partners at the AARP, working with our partners at Alzheimer's, American Lung Association, Cancer Association, Heart Association, working with our local partners, our CERT teams that are part of our mutual aid program, traditionally utilized in preparation for our wildfire seasons, our Listos program, which we rolled out a few months ago to do the same. We're now reconstituting all of those programs and building capacity and partnership to significantly increase our connectivity to our seniors, to check in not just for wellness checks related to food and medicine, but the deep anxiety people are feeling, being isolated at home, and the loneliness people are feeling at home, not connected to the outside world, anxious about their life and their loved one's life. And so neighbor by neighbor, we're asking people to make 5 calls. We've worked in social media platforms next door to do just that in 22,000 neighborhoods across the state. We've already connected through that platform just shy of 8 million individuals, but we have to go deeper and we have to do more. And we have to do it in a way that not only just checks in on someone to see how they're feeling, but be able to deliver something on the back end, not just a meal or medical supplies. And that's why we've created a hotline for people across the state that will guide them to more substantively deliver on the needs of the individual they're contacting. And that site has a following number, 833-544-2374, 833-544-2374. That hotline will allow individuals to be able to get questions they may have answered in ways that they can individually participate in helping support this moment in the spirit of civic contribution, in the spirit of the commonwealth, in the spirit that defines this moment, that we're all bound, as Dr. King said, bound together by a web of mutuality. And that commonwealth, it is incumbent upon us to check in on the greatest generation. People have brought us the world's most vibrant middle class and obviously have done so much for all of us. We have a unique obligation to do more for them. But in that spirit, to be able to do more, we need not just that one point of contact, that one hotline. We need to be able to drill down in a more substantive way. And so we've partnered with our 211 system. Our 211 system is an incredible system in the state of California that connects people to real services in real time. So if a loved one or a neighbor or a stranger is in need, and they need something more than just nice words and just a check-in, but need specific services, we've partnered now with 211 to provide those services at the local level all throughout the state of California. I'm going to have a representative here in a moment from 211 speak more about their robust system and what it provides. But I think this is a real opportunity for Californians to check in on the most vulnerable Californians and do so in a way that only Californians can. We'll elevate in that context the spirit, sense of pride that I think we all have at this moment. But let's do so in a way that's meaningful and substantive. And in that stead, I want to ask Richard to come up, who runs the local 211 system up here in Sacramento, to talk about the substance behind what that call center and those 3 three numbers, 211, truly represent and will represent to potentially millions of Californians if we avail and take advantage of that system. Richard?
Thank you, Governor, and thank you to your teams also for the leadership that you're providing in these unprecedented times. I'm the board chair of 211 California and the local operator of 211 Sacramento. And 211 is really a 3-digit dial that makes it easy for our community members to get services at a very local level. Our call centers are staffed 24 hours a day, 365 days a year, and they're trained professionals on the other end of that line that will be there to assist you in doing some case management and getting you to the most fundamental needs. Together, we can work together as a community to start building those resources in those databases to ensure that the community members are getting access to services. Our call specialists are all trained in AIR's taxonomy, which means that they can help sort of provide guidance and determine what those unmet needs are. The 211s are operated by local nonprofits, and we're excited to be part of this program with the state, and we look forward to serving everybody soon.